Today I'll be discussing the protocol taken when dealing with a new client. Key focuses of the presentation will include the screening of a new client and the tools used, further consultation notes, a needs analysis specific to my client, and will conclude with an action plan detailing the next steps of the process. The purpose of screening a new client is to better understand their lifestyle, is to better understand them and to be able to is to better understand them and ultimately individualize it. Prior to commencing exercise, it is paramount that the client completes a pre-exercise screening. The reason behind an exercise screening tool is for the identification and management of risk relating to physical activity. After using these screening tools, it was established that the client had less than 2 risk factors for coronary heart disease, no determining lifestyle issues, and no past or present medical conditions or lasting injuries. And thus, after client consent, I was happy to condone the commencement of a physical exercise regime. The remaining consultation notes will also be utilised to further tailor the program to best suit my client's needs. My client currently undergoes this training program and has confirmed his willingness to commit the same duration and frequency to his adapted program if required. The client's initial goals were further examined and arranged to meet the attributes of a competitive rugby league player in the role of a second row. This is vital as it allows us to provide specificity within the training program. Which brings us to the needs analysis. The training regime needs to align with our goals, and our specific goals need to align with the ultimate goal, which in this case is the performance of a second row in a game of rugby league. So first of all, what do we know about rugby league? We know it consists of 40-minute halves, which are divided by a 10-minute interval. There are a high level of physical contact and involves a combination of frequent high-intensity bouts. Anthropometric assessments supply us with quantified characteristics of the goals we are trying to achieve. Once again, this is further information to apply specificity to our program. The performance characteristics listed are those which have been recognized as vital components of a second rower's gameplay. These will be areas which we will be looking to improve on in order to create a better overall. The pre-exercise process has enabled me to gather all the information required for the premise of a safe and specific exercise program. Goals have been established, safety procedures have been adhered to, and research has been conducted to formulate a science-based program to achieve the goals discussed by client and practitioner. The next step of the process is to develop a clear understanding of the client's current conditioning. The testing methods used will be standardized testing, which will allow for a comparison pre- and post-training, as well as the ability to compare between other teams and players within the rugby discipline. These tests will include a beep test, a 1RM bench press, a 1RM back squat, as well as a laser gate measured sprint over both 10 meters and 40 meters. As per my client's goals of weight management and revised diet plan, he will also be required to complete a food diary over the span of a week to best formulate a change to the diet which will assist in completion of our goals, as well as making them manageable and achievable.